Do you have persistent shoulder pain that just won't go away despite getting a cortisone injection or strengthening your rotator cuff? Well, this is very likely because you've been missing a key piece to managing shoulder pain that can make all the difference in the world. Because the true holy grail of shoulder health lies in the shoulder blade. Being able to control your shoulder blade during activity can help manage and even prevent common shoulder conditions, including subacromial pain syndrome, rotator cuff tendinopathy, arthritis, and even labral tears. So in this video, we will be taking an in-depth look into the shoulder blade, how it works, and why it's so important to address when managing shoulder pain. Hey everybody, welcome back for another episode of Physio Show. Have you ever noticed that when you use your arms, one of your shoulder blades moves a little differently than the other? You may have noticed that you shrug your shoulders while reaching overhead, or have even noticed that your shoulder blade just kind of juts out like a chicken wing. These are common signs and symptoms of scapular dyskinesia, which simply means a lack of sufficient control over your shoulder blade, and can be the very reason why you're experiencing persistent pain or weakness in the neck or shoulder, despite injections or rotator cuff strengthening. Because if your shoulder blade is not functioning properly, your rotator cuff is definitely not. Yet many people who have shoulder pain often just jump straight to strengthening the rotator cuff, with less than optimal results. And while rotator cuff strengthening is important, it should never be the first step when managing shoulder pain. Scapular dyskinesia is a very common condition, but often goes underdiagnosed and improperly managed. Now, some degree of scapular dyskinesia is not that big of a deal, and often is not that much of an issue. However, over time, it can lead to increased strain through your shoulder and neck region. This condition is super common, with pretty much anyone with shoulder pain having some form of scapular dyskinesia. Research suggests that it may present in as many as 70 to 100% of athletes with shoulder injuries, especially those who engage in overhead activities. But in order to understand the condition, you need to first understand how the shoulder normally moves. When you lift your arm overhead, the shoulder blade is designed to undergo a precise combination of upward rotation, posterior tilt, and external rotation. This combination of movements are essential for achieving proper alignment of the nearby shoulder joint. The scapula moves correctly and ensures that the forces through the shoulder joint are well balanced. In total, the arm is able to elevate through an arc of motion of roughly 180 degrees. Out of this total motion, the shoulder blade contributes to about 60 degrees, with the remaining motion occurring at the shoulder joint itself. This 2-to-1 ratio is called the scapulohumeral rhythm and ensures that the shoulder joint remains well aligned during movement. When this rhythm is interrupted, alignment is lost, which places increased strain through the neck and shoulder. But why does this condition develop? Well, this condition can arise from a variety of factors, but simply put, it's most often due to stiffness, muscular weakness, or a combination of the two. Stiffness in certain muscles or joints can restrict the movement of the shoulder blade, preventing it from getting into proper position. On the other hand, weakness in the muscles that control the shoulder blade's motion leads to lack of support and control, which also results in misalignment of the shoulder joint. So both stiffness and weakness can result in scapular dyskinesia, and each person can present with different combinations of the two, making treating scapular dyskinesia very individualized. This makes it important to know exactly what to look for to treat this condition effectively. But before we get into where to look, let's answer a very common question. Which do you address first, stiffness or weakness? A good rule of thumb is to address stiffness first. Stiffness in the surrounding joints or muscles can limit the range of motion of the shoulder blade. If the shoulder blade is unable to properly tilt and rotate, this will negatively affect the alignment of the shoulder joint during movement. Focusing on strength before sufficient mobility is achieved would be the orthopedic equivalent to putting the cart before the horse. You need mobility before you can have sufficient strength and control. That's just how the body works. Now, this doesn't mean you can't focus on strengthening, but if you were to make a pie chart for the time spent on exercise, much of it should be spent initially on mobility. Once sufficient mobility is gained, you can then start to increase the time dedicated towards strengthening the scapular muscles to improve control in the newly gained range of motion. Now, there are common areas of stiffness that develop in those with scapular dyskinesia, the most common of which are the joints in the thoracic spine, or the upper back, the shoulder joint, also known as the glenohumeral joint, and the muscles around the shoulder blade itself. Any stiffness in these regions limits the gliding motion of the shoulder blade, affecting its ability to position itself optimally during shoulder movements. The thoracic spine plays a big role in how the shoulder blade moves. In particular, its ability to extend and rotate is of importance in most of our daily activities and allow for a wide range of arm movements. However, prolonged periods of poor posture, excessive sitting, or even past injuries can lead to stiffness and limited mobility in this region. Just try to slouch forward and then raise your arm overhead. Then do this when standing upright. You can see how much more motion you have when the upper back is more extended than when it's in a flexed position. When the thoracic spine lacks mobility into extension or rotation, it affects the shoulder's ability to achieve proper alignment during movement. The shoulder joint is another common area of stiffness that can develop. Just as the alignment of the shoulder blade impacts the shoulder joint, any limitations in shoulder mobility will also directly impact the movement of the shoulder blade. Normally, the joint is a very mobile joint. The best analogy for the shoulder joint is a golf ball sitting on a golf tee, with the golf ball being the end of the arm bone, which fits into the cup-shaped socket part of the shoulder blade. Like the ball and the tee, there is not a lot of contact between the two bones, which allows us to move our arms freely in a dynamic way. Like the shoulder blade, we also need the shoulder joint to have plenty of mobility, because otherwise our muscles wouldn't function as well. What is very interesting is that when the shoulder joint is stiff, the scapula actually tends to move more than normal. This tendency is due to the shoulder blade trying to make up for the lack of mobility in the shoulder joint, which is most often seen with excessive shrugging, increased upward rotation of the scapula, or excessive scapular winging. Now, these movements can also be caused by weakness, so it's important to know how to differentiate what's causing it. Now, as we mentioned, the shoulder blade normally goes through a combination of posterior tilt, external rotation, and upward rotation to properly align with the shoulder. Just as the muscles help to perform this movement, there are also muscles that resist this movement. If the muscles that oppose the movement are overactive, they too will alter shoulder blade position. Common muscles that restrict these movements include the levator scapula, pec minor, and rhomboid muscles. If you feel like this video has been beneficial so far, give it a like so it can spread to more people, and help them out as well. I would really appreciate it. Now, after regaining sufficient mobility, you can then shift your attention to strengthening the appropriate muscles. Now, if you take anything away from this video, it should be that the scapula sets the stage for how the shoulder moves. Without proper scapular control, the shoulder has no chance of functioning at a high level. I like to think of the scapula as the wings on a plane, guiding the direction of the shoulder's movements as we reach overhead. Like the plane's wings, the scapula navigates the shoulder through smooth and coordinated movements. When the plane's wings work properly, the plane glides effortlessly through the air. If the wings are misaligned or the flaps stay down, the plane is hard to control, increasing the turbulence and stress on the plane. Too much turbulence, and you're going to have a pretty bumpy ride. Sufficient strength and control of the shoulder blade is dependent on the coordinated effort of several key muscle groups. There are three primary muscles that play a vital role in controlling scapular motion when elevating the arm: the serratus anterior, the lower trapezius, and the middle trapezius. Working together as a coordinated team, they ensure smooth and controlled movement of the shoulder blade, establishing a stable foundation for the shoulder's actions. Like the plane, when functioning properly, the shoulder blade glides smoothly along the rib cage. The serratus anterior muscle starts in the inner border of the shoulder blade and wraps around the outside part of the rib cage, resembling the shape of a feather. Its primary roles include upward rotation and forward motion of the shoulder blade. Upward rotation aligns the shoulder blade with the arm bone when you raise your arm, while the forward motion allows the shoulder blade to glide smoothly along the curved surface of the rib cage. The trapezius muscle is a big triangular muscle spanning from the neck to the lower mid-back, divided into three parts: the upper, the middle, and the lower trapezius. During arm elevation, the middle trapezius acts as a counterbalance to the serratus anterior, controlling how much the shoulder blade shifts forward, ensuring the shoulder blade maintains a nice central position of rotation. The lower trapezius plays a role in external rotation and depression of the shoulder blade, assisting the serratus anterior in upward rotation movements. A strong and well-developed lower trapezius helps balance the often over-dominant action of the upper trapezius and levator scapula, which tends to pull the shoulder blade in an excessively upward position. As you can see, there's a lot going on with an amazing amount of interplay between joints and muscles. Any stiffness or weakness in the area will lead to imbalance and cause scapular dyskinesia, affecting the overall movement and stability of the shoulder, causing pain, reduced range of motion, and potential shoulder injuries. So hopefully now you see why you may not respond to just injections or strengthening the rotator cuff. By improving the mobility and enhancing the strength of the muscles of the shoulder blade itself, you can help clear up many of the common pains of the neck and shoulder.